Hello, this is Dr. Eric Edka. Yes, I am the Richmond Chiropractor, and I have been in practice for over 9 years. And recently, being in Richmond, Virginia, and doing chiropractic there for the last 2 or 3 years, we've noticed an increase in cases with sciatica pain, and we've had great results with helping people get relief. So we wanted to provide a video on some of the solutions that we use in our office that many people could probably just do at home as well. So just like you see this guy on the right, the sciatica pain going down the back of his leg, a lot of people come to our office thinking they have sciatica when sometimes it might just be a low back problem or possibly just a bulging disc versus a herniated disc. So there's different ways to tell. So we're going to get started. And a lot of people come in, they say, "Doctor, I think I have sciatica. Can you help me?" And of course, we do our best to help as many people who come into our office as possible. And it takes work from both a great doctor like myself and a patient who's committed and willing to do the work necessary, so that we need to understand exactly what's going on with the nerves in the back of the leg. So these nerves here, they go out of the spine in the lower back. They run out the lower back down here, and there's also a larger one all the way down the back of the leg. So we definitely do a couple different checks with patients by lifting their legs up, having them also hold both of their legs, do a couple different neurological and orthopedic tests to make sure that it may be not sciatica, possibly something wrong with just a muscle spasm, or we also have to figure out if it's a disc issue in between the spinal bones. Now, it's very simple to see on a different model here, where you can see very closely, here's your lower back. And this would be the hip where you have the dimples in your lower back. And down here is the side of your hip bone itself where your leg comes into it. So we know that the sciatic nerve comes out of L3 and 4 and 5 and S1 nerve root coming down the back of the leg. So a lot of times patients come in, they're holding their lower back right here, and they invariably think they just have sciatica. So it's very important that first we diagnose and make sure that it is sciatica, because that means several different things, and of course it's a different treatment as well. So as we go, the doctor, what can I try for relief? People want to get relief fast, they want to feel better, they want to be able to pick their kids up at night, they want to be able to give them a bath without having back pain. Moms are always telling me things like carrying the groceries, carrying a baby, doing laundry, doing things, driving a lot, sitting at computers. They want to get relief. And so we've put together some very specific ways so that we don't have to deal with that red burning pain in the back of our leg going down of our hip and then sometimes even into the calf and the foot. So there's a different way we start out with taking care of our patients who truly do have sciatica. And they're called Mackenzie exercises. So this therapist figured this out many, many years ago to put the lower back into extension down here on the ground. It's a very gentle exercise, very simple. Kind of looks like a halfway of a yoga pose, but it's really mostly important just to put the lower back right here into extension to make sure the disc fluid goes back to where it needs to be, and it also eases the lower back muscles. Also, ice is always the safest thing you can use. Just 10 minutes. We don't want it directly on your skin. Use a small towel, a small wet towel, paper towel, anything in between you and the ice would be very, very important. And just 10 minutes. So obviously you know how to put ice on your back without directly on you. Now the hamstring goes down the back of your leg, right where that sciatica nerve is also going down. So we're going to show you a sitting hamstring stretch, just like this little diagram here. Very simple, very gentle to do. I think anybody can actually do this and get some benefit. If you feel a little bit more advanced, you can follow through and do the exact same thing that this lady's doing here in the next photo. Now also, we want to make sure, just like with the Mackenzie exercises, we keep that lower back in extension. So you can lay on your back with a small rolled up towel under the belt line area, because that's where those nerve roots are, L3, L4, and L5. So there's a very easy way to start getting some relief at home. It's gentle. You shouldn't have any issues. Don't overdo it. And if it continues,